Hello everyone, welcome back to my YouTube channel Running Pharma by Priya. Today I am going to discuss with you the very important part, that is question bank, which is based on the pharmacology subjects. So total 50 questions are there, which is very important for the exam point of view. So without wasting much time, let's start with the video. Hello everyone. So today I am going to discuss with you the 50 pharmacology very important question bank. And as you know, GPAT exam is coming soon, so you have to prepare according to the subjects. Like you have pharmacology for the total 28 questions coming from the pharmacology subjects. So yeah, let's start with the pharmacology. Now the first question, we will head towards the first question, that is neural tube defects may occur by which of the following anti-seizure drugs. So options are ethosuximide, vigabatrin, valproic acid, primidone. Yes, so you can think for a minute and let me know the answer in comment section. Ethosuximide, vigabatrin, valproic acid, primidone. So the answer is yes, correct. I hope many of you given the correct answer. That is option is C, valproic acid. So valproic acid is the anti-seizure drug which causes the neural tube defect. Let me take a pen. Which causes the neural tube defect. Go to the next question. Now the next question is, which one of the following is a beta-lactamase inhibitor? The options are penicillinic acid, embonic acid, cephalosporinic acid and clavulanic acid. So these are the four options and you have to identify which is beta-lactamase inhibitor. So beta-lactamase inhibitor is, yes, that is answer is D. Clavulanic acid is the correct answer for the beta-lactamase inhibitor. Now we'll go to the next question. Question number 3. Question number 3 shows that which one of the following is a non-competitive inhibitor of the enzyme reverse transcriptase in HIV. So as you know, antiviral drugs is very important topic for the GPAT examination. So you have to prepare wisely, because it is little bit confusing what is competitive, what is non-competitive inhibitor, what is the reverse transcriptase inhibitor, what is non-reverse transcriptase inhibitor. So please read it carefully and slowly so you can understand. So now come to the question again. Tell me which one of the following is non-competitive inhibitor of the enzyme reverse transcriptase in HIV. So options are lamivudine, nevirapine, abacavir, tenofovir. So the correct answer is B, that is nevirapine. So I can give you the little trick here. Non-competitive, it will start like if options are there N, E, Z, there are 3 drugs. So first drug is nevirapine, and let me know in comment section which is 2 drugs, 2 another drugs. Okay, so N, non-competitive, nevirapine. So you can remember likewise. Then fourth question, question number 4 is, rhabdomyolysis is the side effect associated with which one of the following classes of drug? So options are ACE inhibitors, statins, calcium channel blockers and sodium channel blockers. So rhabdomyolysis is the side effect, or we can say the adverse effect associated with the, yes, so option B is the correct answer, that is statins. Then take the drug belonging to antibiotic macrolides. Which one of the following is a macrolide antibiotic? So options are neomycin, erythromycin, doxycycline, cefotaxime. Yes, so maybe you are thinking neo, erythro, doxy. So while studying these antibiotic drugs, you can do one thing, like studying all those options. You have to write here which is the neomycins category, which is the doxycycline category, cefotaxime category, right? So option is B, correct, that is erythromycin, that is macrolide antibiotic. Go to the next question, that is erythromycin is given in intestinal hypomotility because why? So the drug erythromycin is given in intestinal hypomotility because there are 4 options. It increases the bacterial count, it decreases the bacterial count, it binds adenyl cyclase, or it binds motilin receptor. So option D is correct because it binds motilin receptor. Okay, go to the next question. So this question, see. Which one of the following is a topical aminoglycoside? Topical aminoglycosides and systemic aminoglycoside. There are two types, right? So options are A, B. A is amikacin, B is cysomycin, 3 is neomycin, pharmacetine and nettilamycin. So option right, C is correct. Here I have put this option because, sorry, I have to write here C and D. Neomycin and pharmacetine, these are two the topical aminoglycoside and remaining are systemic aminoglycoside. So if option in exam it will come neomycin or pharmacetine, you have to go for the this option number C. Next is, which is the source of chloramphenicol, that is Streptomyces venizeoli, Streptomyces aurofaciens, Streptomyces remosus, Streptomyces griseus. So the answer C is correct, that is answer A is correct, that is Streptomyces venizeoli. Answer A is the correct option for this question. Okay, so accordingly you have to do the sources for all remaining drugs as well. Question number 9. So as you can see on the screen, question number 9 is, one of the following act as an antiemetic agent to antagonize the D2 receptor. So you have to identify which one of the following the drug which act as an antiemetic agent, okay, and which will antagonize the D2 receptor. So you have to understand D1, D2 receptors are there. So as here I can say the unit 1 from the KD Tripathi book, which is very important for the purpose of these are the basic question. You should know the receptors, right? So there are options. Option A metoclopramide, option B ondansetron, option 3 nabilon, option 4 cyclizine. So the correct answer is yes, correct. Option A is the correct answer, that is metoclopramide. Then next question number 10. Following is the example of class 1B antidysrhythmic agent. So options first is lidocaine, flecainide, amiodarone and procainamide. As here I can say the anti-dysrhythmic agents are very important as exam point of view. You have to do all the classes, class 1, class 2, class 3, class 4, all classes you have to do. And yes, the correct answer for this question is lidocaine, option number A. Go to the next question. The mechanism of action of digitalis is, yes, so this is in cognosy, this is in ecology. You have to, this digitalis drug is very important as exam point of view. So you have to read complete drug properly in cognosy as well as in pharmacology. So the options are, the first option is decrease intracellular sodium concentration. Option number B, inhibit sodium potassium ATPase. Option number C, activate adenyl cyclase which produces CAMP, that is adenomonophosphate. And option number D, decrease release of calcium from sarcoplasmic reticulum. So this is very important. As you know, digitalis is a cardiovascular drug. So the option number B, that it inhibits sodium potassium ATPase, is the correct option. Go to the next question, that is which drug inhibits cholesterol absorption? Okay, which drug inhibits cholesterol absorption? Options there are, first option is cholestyramine, second cilostazol, third propofol and fourth one ezetimibe. Yes, think about it. Yes, option number D, that is ezetimibe, is the correct option. Minoxidil. Minoxidil is, what is minoxidil? Okay, you should know what is minoxidil. The first option is multiple sites including alpha 2 agonist, catecholamine release. Option number C, sympathetic neuron block. Option number D, non-selective vasodilation. What minoxidil is do? That is, it is non-selective vasodilation is the correct answer. The next question, what is the mechanism of nitrate? There are four options. Inhibiting phosphoesterase. Second is stimulating guanylate cyclase. Third is beta blocker and calcium channel blocker. Yes, so mechanism of nitrate, obviously you should know the answer, that is B, stimulating guanylate cyclase. Question number 15. Which one of the following drug is used to treat hypertension during pregnancy? So option number A, hydralazine, B, diazoxide, C, clonidine, D, minoxidil. So the correct option is A, hydralazine. which can be used during pregnancy for the purpose of treating hypertension. Question number 16. Calcium channel blockers are used in cardiac infarction because. Why we are using calcium channel blockers for the cardiac infarction? Because option number A, to increase cardiac output, B, increase BP, C, reduce the size of infarct, and D, increase conduction along the muscles. So here calcium channel blockers, so obviously it's blocking something, right? Blocking something means it's decreasing some activity. So other three options are increase, increase, increase. So the option number C is the correct, that is the reduce the size of infarct. Question number 17. Oh, already I have highlighted. Captopril exerts action by. Answer is inhibiting conversion of angiotensin 1 to 2. So you know that cycle, that is a AC inhibitors. These are the AC inhibitor category, captopril, and it inhibits the conversion of angiotensin 1 to 2. Correct answer is the B. Question number 18. Drug of first choice in supraventricular arrhythmia is. Drug of first choice in supraventricular arrhythmia is. The first option is quinidine, B, procainamide, C, verapamil, and D, amiodarone. So the first choice in supraventricular arrhythmia is. The answer is C, that is verapamil. Question number 19. Phosphodiesterase inhibitor is used as PDE. You have heard about it, right? So options are vasoconstrictor, vasodilator, hypotension, antidiuretic agent. So the correct answer is vasodilator. It acts as a vasodilator. Question number 20. Beta blockers are contraindicated in patients with. So in which condition you cannot give beta blockers? The options are if supraventricular tachycardia is there, hyperthyroidism is there, coronary artery disease, or all of the above. So yes, you have guessed it right. The C, coronary artery diseases are there, then you cannot give the beta blockers. Question number 21. Ligand gated ion channel also known as. Very easy question. Ligand gated ion channel also known as ionotropic receptor. B is the correct answer. Carvedilol is a. This is very interesting question. Always this type of questions come in exam and it confuses you for beta 1. It is selective, non-selective, or both. So option number, yes, D is correct. Both alpha and beta antagonist. If you can please note this question because it is very important, and also do the classification very carefully because always question will come from those categories which is a little confusing to the students. Yeah, question number 23. All of the following is mast cell stabilizer except option number A, sodium chromoglycolate, option number B, nadochromyl, option number C, that is ketotifen, and option number D, that is xylitol. So option number, you know, sodium, necro, and ketotifen are mast cell stabilizer. Option number D is the correct, that is xylitol. Yeah, so question number 24. Amyl nitrate is given. How? What is the route of administration of amyl nitrate? Sublingually, orally, inhalation, IM. So correct answer is yes. So amyl nitrate is given inhalation, by inhalation. Here also I have mentioned this. I will tell you one story here. A pregnant lady who is suffering from TB, the following drug is contraindicated. So ethanamide is very contraindicated drug. If the person is suffering from any lungs diseases like TB or any other lung problem, so ethanamide is the correct option, B. Question number 26. Which of the following antitubercular drug is an inhibitor of DNA dependent RNA polymerase? This is very confusing. DNA dependent RNA polymerase. So you have to remember this category, and the options are rifampicin, streptomycin, ethambutol, thiacetazole. Yes, here I will give you to think about the answer, and I hope you are thinking right. The answer, correct answer is A, rifampicin. It is the inhibitor of DNA dependent RNA polymerase. Now the question number 27, treatment of choice in cerebral malaria. So you know there are various types of malaria. So cerebral malaria, the what is the very important drug which is used for this to treat cerebral malaria? The options, chloroquine, amodiaquine, quinine and primaquine. The answer, yes, C is the correct option. Quinine is the correct option for the cerebral malaria. Then antiviral activity of zidovudine is due to, like I said, antiviral drugs are very important. You have to read thoroughly the topic antiviral drugs which is comes under chemotherapy. So I am here asking you the mechanism of action of zidovudine. So there are four options: inhibition of viral protein synthesis, inhibition of the viral RNA dependent DNA polymerase, inhibition of the viral RNA polymerase, and none of the above. Yes, so answer is this, B, RNA dependent DNA polymerase. Like we have seen, I guess, two questions before, the mechanism of rifampicin, which is DNA dependent RNA polymerase. Now go to the next question. Sulfonamide blocks the synthesis of which of the following? PABA, DFA, DHFA, TFA. And I know you know the long form of all those. What is DFA? Let me know in the comment section. What is DHFA? Let me know in comment section. And TFA. So sulfonamides is a very important category of antibiotics category, and which block the synthesis of, yes, that is dihydrofolic acid. Okay. Dash can be given in renal toxicity. Yes. So if you have a kidney toxicity or any kind of kidney disease, so for that which drug can be given? So options are demeclocycline, minocycline, doxycycline and tetracycline. So these are the four options. Let me know the answer. Exactly, the option number C, doxycycline, is a very important drug for renal toxicity. Now, aminoglycosides work by binding with dash ribosomal units. So 30S, 50S, 40S, both A and B. As you know, 30S, 50S, 40S, I don't think so you have heard about 40S. Maybe you heard about 70S, but yes, the option number D is the correct option, 30S and 50S. So aminoglycosides is the category which is bind to both the type of ribosomal RNA or subunit, that is 30S and 50S. So answer D is the correct option. Now the next question number 32. Ganciclovir is the drug of choice for which one of the following virus? Yeah, again the antiviral. Influenza virus, cytomegalovirus, pox virus, adenovirus. So the correct option is exactly B, cytomegalovirus. Then question number 33, which sulfonamide is used topically? This question came, I guess, in 2018 GPAT examination. So option number C is the correct option, silver sulfamide, that is silver sulfamide. Question number 34, clavulanic acid is, yes. So we have seen the opposite question before, that is inactivate bacterial 13 lactamases. Then 35, treatment of systemic fungal infection is, example option metronidazole, cotrimazole, ketoconazole, amphotericin B. So yes, if the systemic infection is there, this word is very important. If systemic infection is there, obviously you are giving amphotericin B. Okay, yeah. Question number 36, disruption of the purine and pyrimidine bases of DNA pairing occurs with 5-fluorouracil, methotrexate, cyclophosphamide, all of the above. Yeah, answer would be C, that is anti-cancer drugs, cyclophosphamide. Halothane is used as, here I can say the local anesthetic and all systemic anesthesia are very important part, and you have to learn the category, and all the kind of drugs comes under this category, like intravenous, inhalational, local anesthesia. Please learn the category and drugs. So halothane comes under the right, the B, inhalational anesthesia. The most specific agent for treatment of petit mal epilepsy is, question number 38. The most specific agent for treatment of petit mal epilepsy is, option number A, the primidone is the correct option. Which one of the following H1 receptor antagonist is sedative? H1 receptor antagonist is sedative. Option are levocetirizine, loratadine, fexofenadine and doxylamine. So the correct option is doxylamine. Option number D is very correct answer, that is the H1 receptor antagonist which is act as a sedative. Okay, yeah. Question number 40. Which one of the following, let me take a pen. Which one of the following is H1 receptor antagonist? Okay, sorry, that we have completed, doxylamine. Question number 41. Question number 42. Stage 2 anesthesia is a stage of, sorry for that, I guess 1 or 2 slides I have repeated. Stage, just copy paste because of that. Stage 2 anesthesia is a stage of analgesia, option number A. B, respiratory depression, option number C, excitement or delirium, and option number D is surgical anesthesia. So the correct answer is yes, that is the excitement and delirium. Which of the following act as a mucolytic? Yes, guaifenesin, noscapine, let me take the pen, guaifenesin, noscapine, ephedrine, bromhexine. The correct answer is D, that is bromhexine act as a mucolytic. All of the following are used as the treatment for Alzheimer's disease except donepezil, rivastigmine, galantamine, selegiline. So selegiline is the correct answer, D. Question number 45. The appropriate antidote in the treatment of pentazocine overdoses is, so the narcotics. Here comes the narcotics category, and I can say this is little bit confusing, so please learn the drugs, only drugs, so that will help you to solve these kind of questions or the category kind of questions. So properly learn the drugs. The option number A is nalorphine, levolorphan, naloxone, any of the both. Option number D, any of the both. So you can use any for the pentazocine overdoses. For question number 46, risperidone is agonist of the following receptor except, yes, that is D1 receptor. Question number 47, that is drug of choice in motion sickness is, scopolamine is the correct answer. Question number, option number B is the correct answer. 48, that is risk factor for aminoglycoside induced neuromuscular paralysis. So Parkinson, use of diazepam, myasthenia gravis, asthma. Yes, so myasthenia gravis is the correct option. Now the question number 49, which is not an aminoglycoside antibiotic? Option number A, amikacin, B, gentamicin, C, clindamycin, and fourth is dobramycin. The correct answer is C, that is a clindamycin, which is not comes under the aminoglycoside antibiotic category. And the last question, tetracycline inhibit protein synthesis by. So this is for you. Solve this question and let me know in comment section. Thank you very much for watching this video, and if you have any question, please feel free to comment in comment section, or you can mail me on my mail ID. And this channel will give you many perspective of pharma education, pharma jobs, like you can see pharmacy career and everything. Okay, if you have any query, please let me know in comment section. Thank you for watching. Please like, share and subscribe to my channel Running Pharma by Priya. You will get many more updates for the pharma. Yes, thank you very much.